Hello students, in today's lecture we are going to study about Glasgow Coma scale that is used basically in neurology. Whenever a patient meets an accident, road traffic accident, whenever a patient got injuries in head and spinal cord and he is unable to move his limbs, either he is unable to talk, when he is not cooperating, when he is not oriented with environment, with their family members, he is unable to recognize them, then this type of scale is used to measure how the severe patient is in severe condition or not, whether patient is in good condition or in medium or in coma or he is dead. So basically these components are used. Three components are used, that is eyes, verbal and motor. EVM, glass claw common scale, is also called EVM. E for eyes, V for verbal, M for motor. In eye we are having 4 points, in verbal we have 5 points, and in motor we have 6 points. So it's in ascending order, 4, 5 and 6, and here all the scores are given 1, 2, 3, 4. No zero is given here. The score is given. For example, if we see in eye there is a spontaneous opening of eye. This gets 4 points. Whenever doctors command a patient to do anything, or whenever he talks, the patient moves his eye and gives a response instantly, spontaneously. That's why it is spontaneous. Sound means patient is listening, he's rotating his eyes, but not spontaneous. But whenever he gets a sound, then he can rotate his eyes. Pressure, patient is only opening his eyes whenever pressure is applied. Whenever all the things are done, you are talking, you are giving pressure, he's listening sound but he's not opening, then 1 point is given. In verbal you can see oriented means whenever you talk to a patient, he is oriented, he knows where he is, what is his name, he will cooperate easily, he knows orientation. Orientation means knowledge to know where he is, time, place and his identity, that is oriented. Confused means patient will talk but his words will be confused, like he will talk in one topic and he will start another topic. Words he will utter in third score, we can see the patient is only uttering words, means appropriate talking, means you're talking in some topic and he will start uttering some words, not a sentence. In a score, whenever a patient talks and makes a sentence but he's confused, we are giving him score 4. He's not making sentence but he's uttering words, then we are giving 3 score. He's making some sound from mouth, he's trying to speak but vocals are not clear but some sounds are coming, then we can give 2. In spite of every in spite of talking and we are asking him again and again but he's not responding, then we give him score 1. In motor there are 6 components. In motor we will say patient to lift his limb, any limb, upper limb, lower limb, to up and down, he will obey the command, then we are giving him 6 score. He is listening and he is doing the command, but not so much in fast movement, just locally. Means so the 5th one is local. If we ask patient to lift his limbs, he will try to lift but slight flexion will be there, means he will trying to lift but there will be a flexion, that is, then we will give him 4. After listening the command, he's trying very hard but lifting slightly, very less flexion, then we can say abdominal flexion. In spite of asking, patient is trying but in spite of lifting he is just extending the limbs, that is extension of the limbs, then we will give score 2. And he's not, in spite of trying hard, he's not able to lift his limbs, then we will give score 1. So in motor we can say person is obeying, then give 6 if he is moving locally, and here local becomes 5. LOCL local 5. This is 5. Flexion means folding means FO and D 4. So you can easily remember F for 4. So abnormal flexion is 3. Extension okay, extension is 2. T comes, so you remember T for 2. None 1. Okay, so in motor we are having 6 score, in verbal we are having 5 score, in eyes we are giving 4 score. So after calculating all this we are getting 15. If a 50 GCS is 15, if a person has a GCS 15, we can say the person is normal. If a person is confused, is talking appropriate, he comes in between 15 and 3, that is in between them. So we can say prognosis is good. Patient is not oriented, he's confused, he's not able to move his limbs, and through these we can check the severity of the disease. Lots of disease comes whenever a patient needs a spinal injury or brain injury. Okay, so these are the components which comes in Glasgow Coma scale, and these are the easy way to remember. Okay. Thank you.